Hello cruel world, my name is Dr. Shaham Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. So today's episode is about chemical castration. This is a controversial practice which decreases the hypersexuality in sex offenders. So watch this episode and you can impress your friends next time you're at a dinner party when the conversation inevitably turns towards the topic of paedophilia. So how does chemical castration work chemically? How does it work practically? And what are the moral and ethical hurdles? I educate whilst you penetrate. I educate whilst you vegetate. Okay, I'm gonna turn down my joke meter and put on my serious face when I talk about this next following tragic case. Trigger warning, it's a bit disturbing. So the case is about a rapist named Dinesh Yadav, and he was a labourer from India who was given a 10-year sentence of rigorous imprisonment, and I'm quoting that from an Indian news article. I had kind of assumed that all imprisonment was rigorous. I don't know, maybe there's a less rigorous option, maybe for vegans or something, I don't know. Yadav had sexually abused his stepdaughter for almost 4 years in North Delhi in India. And he also got a fine of around £250, which, to be fair, is probably a lot of money for an Indian labourer. This all reminds me of the horrific abuse suffered by Valerie Bacco, who ended up killing her husband. So see my separate video on this channel about that. There's also the defence of battered woman syndrome if you're interested in that kind of thing. So back to the Indian case, the judge, who was named Judge Lau, said the following: "If this is not a case for which the highest punishment is called for, then there can be no other worse case than this. In my view, it is time that we as a civil society stand up and also think about a law similar to the ones existing in many developed countries, providing for surgical and chemical castration." So the victim in this case was the stepdaughter, who was aged 15, and the perpetrator, who I said before was called Dinesh Yadav, was aged 35. And after the death of her biological father, the victim's mother married Yadav, and they had 5 children together. Initially, the victim lived with her maternal grandmother, but later, when she was about 8 years old, she started living with her mother and also with Yadav. He'd been accused of raping her over the period of 4 years. And whenever the mother tried to protect, she was beaten badly. So I have to say, Yadav sounds like a real piece of work, by which I mean a real piece of shit. The judge went on to say, "The convict represents the depravity and abysmal depth to which a man can go, for here is a case where a convict does not spare his own daughter and beats and batters his wife when she comes to her rescue. This is a crime required to be addressed differently, and a full public debate with regard to the imposition of castration, both surgical and chemical, as an alternative punishment for the offence of rape and molestation is in crying need of the hour." That's what the judge also said. Wow, surgical castration as well. Judge Lau is about that life. She does not mess around. And then the judge also said, "Young girls are not safe even in their own families, where fathers and brothers turn predator." It is sickening indeed. Rape is a growing menace which the administration is finding hard to tackle. Even stringent punishments so subscribed under the law do not appear to have any deterrence. I have to say, I like the way this judge thinks, and she's also very poetic with her words. I wonder if she's considered ghostwriting for any YouTube channels. So next question, where is chemical castration used? Well, chemical castration is not just an option in India, it's also used in countries like the USA, the UK, and Germany. And it's actually mandatory for sex offenders in certain countries. Would you like to guess which countries, dear viewers? Answers later on in this episode. Next question, what is chemical castration and who is it used for? Well, it's an administration of a medication designed to reduce libido, which is sex drive, and sexual activity in the hope of preventing rapists and child molesters and other sex offenders from repeating their crimes. It's seen as a voluntary alternative to the life imprisonment or the death penalty. The drug used is known as Prostap, although I think they've missed the trick because they should have called it Pervstop. High five. Don't leave me hanging. And how it works is it switches off the male hormone testosterone, which is linked to sex drive in paedophiles and sex offenders. It should be used for those with compulsive or impulsive urges to offend, or those who have difficulty controlling sexual arousal and I have these like dangerous tendencies. So the next logical question is, does it actually work? Well, before I answer that question, I'd like to introduce you to this channel. You're watching A Psych for Sore Minds. My name is Dr. Shahom Das. I'm a consultant forensic psychiatrist. I assess and rehabilitate mentally disordered offenders in prisons and in courts in secure psychiatric units. I work as an expert witness, which means that I give evidence in criminal court trials about psychiatric issues. I'm legit, is what I'm trying to say. This channel covers a whole range of issues related to true crime and offending. Sometimes I dissect high-profile true crime cases. Sometimes I talk about my own patients. Sometimes I interview people. It's a whole smorgasbord. What I'm trying to say is there's something for everybody on this channel. And I implore you to subscribe, because not only does it help me out immensely, but it actually kills the fungus on your toenails so you no longer have to walk around looking like a werewolf. Guaranteed or your money back. Okay, so the next logical question is, does chemical castration actually work? And the short answer is yes. So evidence from a Scandinavian study suggests that chemical castration cuts the rate of reoffending from 40% down to 5%. And in terms of the use of the UK, a law allowing voluntary chemical castration was created in 2007 by the Home Secretary, John Reid. Around 10 years ago, 100 sexual offenders volunteered for the controversial government prison initiative piloted in a scheme at Wotton, which is a specialist jail in Nottinghamshire that houses only sex offenders. And it was piloted by one of my peers, a forensic psychiatrist named Professor Don Grubin. Salutations to you, Professor. However, unfortunately, the Prison Reform Trust branded it a waste of money and said that chemical castration is no replacement for proper rehabilitation. Boo! Okay, dear viewers, back to my previous question. Can you think of some countries where chemical castration is mandatory for sex offenders? Ready? Drum roll, please. So they would include Poland, Russia, and even certain states in the United States. So if you got one of those questions right, buy yourself a cookie and you can bill me. And if you got two or more right, treat yourself to a massage and you can bill me. So, like me, many of you are probably thinking that this chemical castration sounds like the best thing since sliced penis. Sorry, best thing since sliced bread. So what are the drawbacks? Why are some people opposed to it? Well, firstly, it needs a high level of supervision because the offenders, they have to keep taking these tablets to lower their libidos. And that in itself is hard work. And also it's controversial as the condition is reversible if the perpetrator stops taking the tablets. Also, it's not a total cure because the sexualized behavior for pedophiles is not only governed by their hormones, but also by their sort of, fantasies. And the fantasies are not assuaged. Some people, including spokespeople from the League of Prison Reform, believe that sex offending is not about sex, but it's about violence and domination, and the drugs will not change those attitudes, and that some men will inflict other types of deviant behavior or other types of harm on their victims if they can't fulfill their sexual desires. And also, as a sex offender cannot function sexually, it provokes objections from certain civil liberty groups. Look, don't shoot the messenger, I'm just telling you how it is, okay? My counter argument is that the victim of rape or of paedophilia, their rights for protection trumps the rights of the sex offender. But where do you guys sit on the ethical spectrum? I don't imagine there's going to be a lot of sympathy for sex offenders, but nevertheless, I would like to hear your thoughts. I would like to hear your comments in the section below. So, next question. What are the side effects of chemical castration? Well, osteoporosis is a big one. So that's a health condition which weakens the bones and makes them more susceptible to fractures and to break. And it also changes the blood lipid levels, and it causes the growth of breasts in men, which is known medically as gynecomastia. It's known colloquially as man boobs, and it's known socially as your father. So blocking testosterone basically makes men into menopausal women. So they get hot flushes, they get mood changes, etc. Right, a word of warning. There was a controversial case, which was Alan Turing. So he's the World War II code breaker. And in 1952, he was prosecuted. And what was he prosecuted for? This is kind of shocking. Well, it's known medically as homosexuality. It's known colloquially as gayness. and it's known socially as your father. So Turin was treated with chemical castration as an alternative to prison just for being gay. And he later died in an apparent suicide. So basically the point I'm trying to make is that chemical castration can be misused. So the culturally cultivated amongst you might know that there was a film about Alan Turing. But, dear viewers, can you tell me what the film was called and which actor played Turing? Answers later in this episode. So just to put a kind of philosophical spin on all of this, some people oppose the legislation, arguing that castration reduces or eliminates deviant sexual thoughts and fantasies. And there's an argument that thereby it's infringing on the sex offender's First Amendment rights in the States to entertain any thoughts, including deviant sexual behavior. But I suppose my counter argument to that would be it's the offences that they've committed, it's the sex crimes that have demonstrated a lack of being able to control the fantasy. So it's their actions rather than their thoughts that are being curtailed. And because of this, they've effectively forfeited their First Amendment rights, in my opinion. Castration is justified to help control their behaviour. So all you American patriots out there watching this, tell me what you think. Okay, let's go back to the previous question. Alan Turing, the World War II codebreaker, was in which film? Drum roll, please. Of course, it was The Imitation Game. And which actor played him? Spenabooch Fumberpatch. Sorry. Genevieve Lungercatch. Sorry. Stenablues Bundeschatch. Nailed it. So I suppose the other issue for me to deal with, and it's my issue, it's not yours, is the ethical issues of a doctor giving that medication. Because a doctor must prescribe Pervstop because they have to follow the patient up, they have to change the doses depending on how effective the dose is versus side effects. They need the background medical knowledge about allergic reactions and about interactions with other jobs. It has to be a professional. And it has to be a forensic psychiatrist, such as myself. Although I've never personally prescribed it, I've certainly seen other patients that have been on it. And it has to be us because we exclusively treat mentally disordered offenders. Yes, all psychiatrists are doctors, not psychologists. Yes, I am a qualified doctor. Yes, I went to medical school. Okay, maybe I might have missed 1 or 2 lectures with a hangover, but you can't prove anything. So my argument is, whereas a police officer or a judge is trained and accepts responsibility to enforce punishment on others, for doctors, we have ethical considerations. We have to consider our oaths. Sorry, I meant our oath. So all doctors take the Hippocratic Oath, as you probably know. This includes the phrasing, I will use my power to help the sick to the best of my ability and judgment. I will abstain from harming or wronging man by it. So like all my peers, I literally had to sign this statement in blood after I graduated. Okay, maybe not in blood. So arguably, you could say that when somebody gives them this drug, even though clearly it helps future victims and decreases risk, arguably you could say it's against the Hippocratic Oath if you take it literally. So what are your thoughts about this, dear viewers? Do you think it matters? Do you even care? Have you even subscribed? To conclude, I hope you've enjoyed this episode. I've told you of a real life case from India where chemical castration was mandated, sparked a debate. I told you about how it works. I told you about some of the disadvantages, some of the side effects, some of the ethical dilemmas. I've given you so much. What about you, dear viewers? Do you think that chemical castration is right? Do you think it's just? Do you think it's moral? Do you think it should be done in all circumstances of sexual offending? Should it only be on a voluntary basis? Should it equate to a lesser prison sentence? Let's face it, it's very likely that you guys are going to be harsh about this, but I'm interested to know your thoughts. So please let me know in the comments below. You Bombay! Before I leave, I just want to tell you about my book. So I've got a book called In Two Minds that is coming out in March 2022. It's kind of autobiographical. It's a bit like this channel, but a lot more of a deep dive. I talk about my life and about my training as a forensic psychiatrist. Of course, I talk about my most fascinating cases as well. You've got to go cop it, you've got to go check it out. Until next time, keep watching my channels, check out my other videos, subscribe, spread the love, tell everybody you ever meet about this channel, your friends and your enemies. I need more subs. I've got a very fragile ego. I need love and reassurance because I'm a weak man. Until next time, stay euthymic and please do not forget, I love you.